Well, this time of year we hear a lot about breast cancer as a race for the cure approaches.
Right, but today we want to take the time to talk about the #1 cancer-related killer. It's lung cancer. There is some positive news on the horizon.
Yeah, and here with important information on who is affected and the latest on treatment, welcome Dr. Apar Ganti. Thanks for coming
Good morning.
in. We appreciate
Nice to see
it.
you.
Nice to
You're
meet
a
you.
specialist in lung cancer. Who should be concerned here? Who does this affect a lot of the time?
Lung cancer has historically been the case, affects smokers, and this includes individuals who've smoked in the past as well. So even if you quit smoking about 15-20 years ago, you're still at risk for lung cancer. However, the worrisome thing is that nowadays the incidence of lung cancer in people who've never smoked is rising. And so lung cancer is not a smoker's disease anymore.
And we've seen that in a couple of high-profile cases over the last 5 years, for example. But there's a new study that just came out, and it's pretty important, right? Tell us
Yes.
about it.
So this is a study that looks at screening for lung cancer. And the reason screening is important is because of what you see here. The proportion of patients who are diagnosed with lung cancer at an early stage where it is curable is pretty low. And with screening, we can detect lung cancer earlier in a larger number of individuals and at a stage where lung cancer is curable. And so if we can screen and identify lung cancer at an early stage, it would definitely improve survival from lung cancer.
Is that what it comes down to, is the screening process?
Yes.
What
Yeah.
puts people at risk for lung cancer? You mentioned smoking.
So smoking is the #1 cause of lung cancer. The next most common cause is exposure to tobacco smoke from the environment. For example, if you are a non-smoking spouse of a smoker, you're still at a much higher risk for developing lung cancer than if a non-smoking spouse of a non-smoker. So those are the two big ones, smoking and secondary smoke.
Yeah.
But apart from that, the other risk factors are exposure to radon, which is very common in our neck of the woods, asbestos exposure, previous radiation exposure. So all of these are important risk factors for developing lung cancer.
So what advice do you have for those people who may be at risk from the secondhand smoke, radon, any of that type of stuff?
The most important thing is to try and find out what is going on. If you notice some symptoms that would suggest that you are likely to develop lung cancer, then that would be something that you don't ignore.
Yeah, we have a list of symptoms, I think. And what are some of those key symptoms that are really important not to underestimate when you start to notice them?
So the most important and the most worrisome symptom is blood when you cough. And that is usually not due to causes other than cancer. Some of the other symptoms that you see here, like recurrent infections, hoarseness of voice, cough that is new or different, pain in the shoulder, pain in the back, difficulty in breathing. A lot of these are important symptoms for lung cancer, but they can also be seen in patients with severe infections and are not necessarily specific for lung cancer. But if some of these symptoms persist for longer than is usual or longer than is seen typically with infections, you should go and see your primary care physician.
That's when you should get it checked out. Well, so what does treatment look like for somebody who's diagnosed? What does it look like now these days?
So the treatment depends a lot on where the lung cancer is, or what we call staging. So like for example here, if this is a section of the lungs, and so if the cancer is located to the lung, you can cut it out. The surgery is the treatment. But in tumors which are large or involve the lymph nodes, these yellow dots that you see here, then you would consider chemotherapy and or radiation. And in individuals who've had cancer that has spread beyond the lungs, then chemotherapy is probably the only treatment option that there is.
The doctors at UNMC Physicians, you and your colleagues, sometimes you work together on treatment plans to really make sure it's the greatest advantage to the patient after they're diagnosed.
Right. So what we have is what we call a multidisciplinary approach. So here what we do is every week all of us get together, that is lung doctors, a pulmonologist, thoracic surgeons. In fact, we have 2 thoracic surgeons who all they do is lung cancer surgery, so they do not deal with the heart or anything else. We have a radiation oncologist who specializes in lung cancer, and we have 3 medical oncologists like myself who also specialize in lung cancer. In addition, we have a team of respiratory therapists, dietitians, and other ancillary staff, who all of us get together every week to discuss all the patients that are being seen by any of us during that week and talk about what the best plan would be in a team approach.
And how comforting for the patients to know that the right hand knows what the left hand is doing, right?
That is very important because with the diagnosis of cancer, you're emotionally so disturbed that if your one physician does not know what the other physician is talking about, it can be pretty disturbing. And so by this approach, we feel that we are able to provide a uniform face to the patient and put to ease their worries that we may not be doing what's necessarily in their best interest simply because we don't know about it.
Yeah, you and the team at UNMC Physicians, you've done a lot of good things to get the word out about lung cancer. What else is going on in the community to help spread the word?
So there are a lot of patient advocacy groups that are trying to remove the stigma that's associated with lung cancer, because if you have read the news and talked to people, the standard response is, oh, lung cancer is a smoker's disease, they deserve to get it because they smoked. And that's not necessarily true. As I said earlier, almost 20 to 25% of new lung cancers that have been diagnosed are in people who either have never smoked or have quit smoking a long time ago. And so that is important to know in order to remove some of the stigma associated with this.
And to make sure you're getting screened early enough that your head isn't in the sand. We're looking at a Facebook page now for Free to Breathe Omaha. We encourage you to visit that site. Also to log on to UNMCphysicians.com. You can reach all of the oncology professionals there, and as we've talked about today, the different specialists that are there and that can help. It's 559-5600. You see the information there on your screen, physically where to find them. But great awareness today.
Yeah, and
Boy,
it's not
some
just
good
a smoker's
points.
disease.
Right.
Yeah,
Thanks
that's
for coming
the
in, some good
takeaway.
information.
We
Thank you.
appreciate your time.
Thank you.
Thank you.
Operation Christmas Child gearing up for one of the biggest weeks of the year.
Yeah, how you can join in to help kids around the world next.